sorely disappointed. So thanks.
Thank you, Jeff. Everett, do you have any remarks?
Yeah, I do. And a lot of these echo Judd's comment. If you look at, there's a wonderful term that I love, and it's called reification. And that means to take some amorphous thing and make it a real living organism. The medical system is now so big that it is reified. It is a living, breathing organism. And you may think everyone's at the table, but when it comes time to the real chopping off, what living organism volunteers to chop off its arm or its leg? Because that's really what you're asking. And you will find that by the fall, what we will do is something like Massachusetts did, maybe, in terms of requiring everyone to have coverage. But not really, we're not going to know by the fall how to take costs out of the system. I mean, we don't know now. How are we going to know by September? So my approach would be, how do you attack this being that's living? Think of this big amorphous thing crawling along, growing. And that's what it is. And it includes insurers, drug companies, doctors, dentists, lawyers, hospitals, everybody. I mean, academicians, state health people. I mean, they all eat from the same tree. I do as a consultant, Wendy does as a consultant. Are we going to cut our incomes? I don't know. So I would say, like Judd, we have to look at some way to change the ultimate momentum of this amorphous being that's eating more and more. And where I would start, I don't think this can be done by September, is with primary care. Because one of the problems that you have today is that no one is managing care. So if you get sick and you go, not necessarily to a local community hospital, but if you go to an academic hospital, stuff happens. I mean, I went to the hospital once, and I don't know what, I had MS. Nothing to do with it. A neurologist showed up. What are you doing here? Beat it, lady. I don't need you. I have pneumonia. Bye. But there was no, I called my primary care doctor. Oh, you're in the hospital. No, that goes to the hospitalist. Now, hospitalists work an 8-hour shift. And they're gone, so who knows about me? Who gets everybody together? And so that there's a coordinated plan of care. No one, God help you, if you get sick and you end up in the best hospital in the world. It's an extractive industry. They will mine you for all your insurance can get. And so I would say we have no one going into primary care because you can't make enough money. So, I mean, I have a lot of ideas on this. I would think of the ROTC program, which pays kids to go through college for nothing and go into the Army. Couldn't we have an ROTC program-like thing for medical school where people go through and maybe stay in primary care 8 years? And then we move them out to the community salaried at good salaries for 8 years so we avoid these perverse incentives. I mean, everyone now wants to go into Durham. Why not? You make twice as much. And there are no, you don't have to carry a beeper, there are no 9 hours. So there are 300 and some odd residencies in Durham, and between 5,000 and 6,000 applicants. I say make 5,000 Durham residencies, and they wouldn't make as much. And people might go back into primary care. But I don't think we can turn the direction on just reified being by September. I agree with Jed, we need to look at something. I would start with primary care and the coordination of care. And even starting there, even if we did an ROTC program or something to bring people in, it's going to be 3 or 4 or 5 years before we start feeling the effect. There's no way to turn the Queen Elizabeth on the dime. So I would start with the management and coordination of care, which means more primary care.